COVID-19 is a multifactorial disease caused by coronavirus, and nearly 90% of COVID infections occur through virus entry in the nasal cavity. The virus starts attacking the nasal mucosa cells as the concentration of virus-attaching receptors is very high on the nasal mucosa. The nasal mucosa is a multiple layer of epithelial cells with connective tissue in between the cells to form an intact nasal barrier. The COVID-19 virus surface contains many protruding spikes, which are glycoproteins. The S1 spike and the RBD, or receptor binding domain protein, bind to the ACE2 receptors situated on the nasal mucosa cells. This allows virus entry into the cells. Virus starts growing, and a huge quantity of newly generated free virus particles are then liberated on the nasal mucosa surface. These viruses attack new healthy cells and open gates for virus entry into the circulation. The immune cells, particularly the mast cells, B and T lymphocytes, get activated and trigger inflammatory reaction by liberating multiple cytokines, particularly interleukin-6 and TNF-alpha, to fight the infection. The immune system tries to control the infection, but if the infection continues, it gets tired, fatigued, stressed, and finally, there is burnout. CoviSpray is a glycerol-based osmotic filmogen solution containing 2 gelifying agents and a few specific dual-acting polymers. Polymers, for example plant tannins, are very big and inert molecules having multiple binding sites for macromolecules and proteins. This is why tannins, or polymers, are used to block skin proteins to convert it into leather. We selected some specific dual-acting polymers which always bind to glycerol and render the glycerol film resistant to osmotic flow for up to 4 hours. Other free binding sites of these tannins are used to bind with specific proteins like COVID virus S1 glycoprotein and interleukin-6 pro-inflammatory cytokine. When CoviSpray is applied on the nasal mucosa, it forms instantly a stable osmotic film. Osmosis creates a strong hypotonic liquid flow from the nasal tissue, swells the gelifying agents, and renders the film absorbent. Osmotic liquid flow equally cleans the nasal surface by detaching and draining the contaminants present on the nasal mucosa. The film acts like a physical barrier on the nasal surface to prevent incoming virus particles of coming into contact with the nasal mucosa. When the nasal mucosa is clean, inflammation starts reducing, which offers a good environment for cells to grow and reconstitute natural, intact nasal defensive barrier. As nasal mucosa is clean, intact, strong, and can defend infection, the systemic inflammatory cascade and immune stress are reduced. In consequence, the chances of immune burnout are minimized. Among the glycerol-binding polymers, we selected those which can bind with COVID-19 S1 spike protein and block the virus, and COVID RBD protein, which allows virus entry into the cells. Trapping the virus in the film will help stop virus infection. The selected polymers are associated in such a way that they can also capture the pro-inflammatory cytokines such as interleukin-6 and TNF-alpha. This multi-target approach of trapping the virus, reducing inflammation, and providing favorable conditions for nasal mucosa repair minimizes the risk of immune burnout and respiratory distress. The clinical efficacy of CoviSpray was proved in a 14-day clinical trial on early-stage COVID-positive patients showing initial respiratory symptoms. The study was performed on 214 patients confined for 14 days. Half of the patients received 2 sprays of CoviSpray 3 times per day. Controls were not treated. Mean respiratory symptoms were evaluated using Leicester Cough questionnaire and a visual analog scale. The results show that CoviSpray immediately stops disease progression compared to controls where symptoms continue worsening during the first 4 to 5 days. Identical beneficial results were seen on other COVID symptom parameters such as fever, loss of taste, headache, and weakness. The results clearly show that CoviSpray can stop the development of severe respiratory symptoms without any undesired effects, provided that the treatment is used as preventive or as soon as the clinical signs appear. The use of dual-acting polymers to act simultaneously on multiple disease parameters is discovered and patented by Vitrobio. Therefore, CoviSpray aims to provide an additional protective measure to limit propagation of COVID-19 pandemic. The start of activity is nearly instant and lasts up to 4 hours. As all the interactions take place topically only on the nasal surface, without interactions with the underlying cells, CoviSpray will be registered as a medical device in Europe